Yeah, really startling number, the highest we've seen, the highest since records have begun. And I think what it's testament to is that there is a really profound relationship between the health of the country and the economy and our ability to lead prosperous lives. What's happened really is, of course, COVID-19 has had an impact. You mentioned long COVID and some of the other changes that have come on. Obviously, we've had disruption in healthcare. But I think the trend that we're now seeing started a little bit before that. It comes down to the fact during the last 10, 15 years, we haven't done nearly enough on population health. We haven't got prevention right. We haven't invested in the things that create a healthy life. We haven't secured the future of the NHS. And now we're really reaping what we've sown. And it's harming the economy in a really profound way.
But it isn't a great deal of this due to COVID, an entirely unexpected, very, very dangerous pandemic, which hoovered up resources, which, as we now know, has extended waiting lists and has, flattened the morale and the energy and everything else of doctors and nurses, plus a major recruitment problem. Isn't that what's leading to this?
So certainly COVID-19, by no means not a challenge. It has accelerated the challenges that we're facing. It's certainly kind of put the NHS into a tailspin. But the fact remains that the UK, if we look back across the data, was getting sicker and sicker year after year from 2010 onwards. Now, COVID-19 making that worse has it's definitely accentuated it. But the problems that we're facing aren't just things that we can leave to go away. If we kind of wait for COVID-19 to disappear a bit, it won't stop happening. The problems that we face are structural. They're down to policy choices. They're down to the fact that we're not putting investment in the things that create healthy lives, things like education, public health services, social security, things that we know are really important to whether people are healthy or not.
How can we be getting sicker and sicker when we're making such tremendous inroads in public health in terms of, for example, people no longer smoking or giving up smoking? For example, cleaner air and more emphasis on, the right sort of fuel rather than the wrong sort of fuel, the money that's gone into persuading people to get on bicycles instead of driving their cars, the fact that people are leading healthy lives, better informed about food and what to eat and what not to eat, and the enormous sophistication of the medicine and the medical treatments available to us that didn't exist years ago. How can we possibly be sicker than our grandparents or great-grandparents were?
Yeah, really, really good question. I think that's the million-dollar question. And I think what it comes down to is that we face some very new challenges. So something like, let's take the case of obesity. That wasn't a challenge in the 1970s and nearly in the way that it is today. I think we had childhood obesity rates of maybe 1 or 2% in the 1970s in the UK. Today, we have childhood obesity rates of nearly 30% amongst year 6 children. So a really profound increase in that challenge. And what we see is this kind of weird dichotomy where we know what the evidence-based policy looks like. The evidence on it is really clear. The big challenge is getting that policy into practice and politicians taking that forward and implementing it. So we see lots of things announced. We, kind of see very often those things then go into the long grass. They're not properly implemented. They're not kind of spread across the country. And so progress doesn't happen. In fact, we're susceptible to the big risks, the big 21st century risks that we face to our health, like obesity.